How does the playing surface affect injury risk? Have you ever wondered how the ground beneath your feet can impact your game on the rugby field? The type of playing surface can significantly influence the risk of injuries players face. In rugby, the two main surfaces are natural grass and artificial surfaces, which include artificial turf and hybrid pitches. Each surface has its own characteristics that can affect player safety. When we look at injury rates, knee injuries are particularly notable. Research shows that matches played on artificial grass pitches have a higher rate of knee injuries compared to natural grass surfaces. In fact, knee injury rates on artificial grass can be about 44% higher than those on natural grass. This is especially true for injuries to the medial collateral ligament and soft tissue. While overall injury rates do not show a consistent difference between artificial turf and natural grass, overuse injuries tend to be more common on artificial surfaces. This means that while you might not see a huge difference in traumatic injuries, the risk of injuries from repetitive stress is higher on artificial turf. The severity of injuries can also vary. Forwards, who often engage in more physical play, may experience longer recovery times when injured on artificial surfaces compared to natural or hybrid surfaces. This is an important factor for coaches and trainers to consider. The mechanics of how injuries occur are also influenced by the playing surface. The tackle is the most common event linked to knee injuries in rugby, with the ball carrier being at greater risk than the tackler. Running and collisions during rucks are significant contributors as well. The characteristics of the playing surface can affect how forces are absorbed and transferred during these events, which can increase the risk of injury. Artificial surfaces often have different traction, hardness, and shock absorption properties compared to natural grass. These differences can influence how players move and how much stress is placed on their joints and soft tissues. For example, increased traction on artificial turf can lead to higher forces on the knee during cutting and pivoting movements, raising the risk of ligament injuries. Natural grass, while generally softer, can vary in quality and maintenance. Poorly maintained grass can lead to uneven surfaces, which can also increase injury risk. Therefore, it is essential to assess the condition of the grass regularly. To help prevent injuries, warm-up routines and injury prevention exercises should be tailored to the playing surface. Exercises that focus on strengthening knee stabilizers and improving neuromuscular control can be particularly helpful, especially on artificial surfaces. Monitoring player workload and recovery is also crucial, especially when training on artificial turf, to reduce the risk of overuse injuries. Coaches and trainers should regularly assess the playing surface and adjust training intensity based on its condition. Additionally, using appropriate footwear designed for specific surfaces can help optimize traction and minimize injury risk. In summary, the playing surface in rugby plays a significant role in influencing the type, frequency, and severity of injuries, particularly knee injuries. Understanding these risks can help players and coaches implement effective injury prevention strategies.